So I decided that I wanted to go into neurology in my third semester at school. It was just the only thing that really interested me, and there was nothing else that I wanted to do. And I studied at a university in Germany that is particularly focused on integrative medicine. But I had a very strong background in science. Like I studied chemistry and biology. And I thought that just looking at the molecules and everything, you would be able to explain the world. So I was very critical regarding all those mind-body intervention types of things. So I was actually, at the time when I was looking for my doctoral thesis, I was looking for a topic that would make it tangible for me, where I could really, with rigorous methodology, study if it worked, if people changed their thought and emotional processes, if that would actually influence the course, the frequency and severity of symptoms in chronic organic disorders. And then I came across this treatment method for epilepsy, like actually a psychologically based treatment approach to epilepsy. And epilepsy, when you look at the dynamic of epilepsy, like in other conditions, you have a buildup of a symptom, like chronic inflammatory diseases, and then it takes a while for the symptoms to decrease, again. In epilepsy, you have the seizure, and then it's gone again. So you have a very dynamic disorder. And it actually is the perfect condition in order to study mind-body interaction. And that's what got me interested in it. Like this particular approach to a condition like epilepsy that is so dynamic. And so I I found this through a German doctor, a neuropsychologist in the States, who had epilepsy herself. And she came up with a treatment overcoming her own seizures. And then she systematized it together with a neurologist. Yeah, actually what we are using is a paradigm that got developed by a philosopher. His name is Varela, and he, I think it was back in the 60s or 70s, that I actually came up with a research paradigm where he said, well, science cannot only just focus on the objective sides of things, the third person data, and it actually has to be correlated with the first person perspective, which is the inside perspective, which you can't really capture if you just measure things. So that's what we are trying to correlate in our research. Right now I'm doing a qualitative study. So we are, well, in that particular study, we don't really have that many third person data, but that's something for the future, where you really then combine EEG measures with qualitative data, first person perspective data. Yeah, sure. It's a qualitative study, and what we're looking at, well, if you allow me, I mean, since this is something that also has to relate to other areas. So if you look, for example, at the treatment of diabetes, we by now know that if you just educate people about how to eat healthy, how they have to move more in order to control their blood sugar levels in type 2 diabetes, you know that knowledge itself is not going to make them change their behavior and not their behavioral habits. What actually is the more important variable when it comes to health promoting behavioral change in chronic conditions, it's something called self-efficacy. And self-efficacy is a complex psychological construct. It's actually the person's belief in his or her ability to do something. And that's what we are studying in epilepsy. We know that in epilepsy, it's a very important variable. We know that one of the reasons people get depressed is not so much because of the number of seizures, but because they feel that they have a loss of control in their lives. They can't do something about the course of their condition. I work with adults, and maybe like the youngest person I ever worked with was 14, so sometimes young people. But the neuropsychologist I work with, she has started working with people at age 8, which is due to the psychological evaluation that we give people. So that's only we can only give that to people starting at age 8. And what we find is that usually when you work with the younger population, you just have to include the family a lot more. Like this has to do a lot with self-awareness, introspective abilities, that kind of thing, self-monitoring behavior, and that you will usually find that with that you have to include the family way more in the younger population. This topic is taking off right now, and I'm really happy about that because, as you know, in epilepsy we have this 30% of people who don't respond to anticonvulsant drugs, and with some of them you can do surgery, but others you can't. And I think that this area, like this is one of the biggest underused therapeutic resources there is, not only in the field of epileptology, but also in general when it comes to the treatment of chronic organic conditions. And I'm right now really busy trying to place this topic wherever I get a chance to place it. So in next year we will have a huge conference in Germany, which is actually going to be by the German branch of the International League Against Epilepsy, and the Austrian and the Swiss one is also going to be involved, so all three countries. And we will have a symposium related to this topic next year. Then also during the course of this year, a task force got created, cognitive psychobehavioral treatments for epilepsy task force within the therapeutic committee of the International League Against Epilepsy. And one of our goals is to update it, Cochrane meta-analysis and base recommendations on that Cochrane meta-analysis. And that is also, you know, going to go on during the course of the next year, and the task force is going to meet during the international conference in Istanbul. And then of course in Philadelphia next year there's going to be the special interest group session dedicated to the topic, in which we are going to particularly dive into the application of psychobehavioral approaches focusing on acceptance and commitment therapy for epilepsy and a relaxation-based approach. And we might even have a skills workshop during which we are going to look over a book on which this particular approach is based, which is called Taking Control of Your Seizures, and which will be published by Oxford University Press next year.